We've got many participants joining, and we will be starting shortly. Fantastic. A good afternoon, good evening, and good morning, ladies and gentlemen, and wherever you are joining this webinar from. Welcome to this webinar, which we have titled Stronger Together, and you will soon learn why. My name is Dr. Samuel Sodube. I'm the Executive Director of FP 2030, and it is my greatest pleasure to welcome you to this webinar, which, as I've said, we have titled Stronger Together, Building a Movement to Integrate Family Planning and Maternal and Newborn Health. Just not in the title, we're saying and, we are not saying to. So we are not integrating family planning to maternal and newborn health, because when you integrate something to, it becomes a moment. But in here, we are building a movement. So as FP 2030 and everyone who is around the room today, we are truly excited to have this diverse group of colleagues, you joining us in what will be the first of many convenings and articles this year. And this will show how we can achieve more in family planning and maternal and newborn health when we decide, when we become intentional to break silos and work together. And why is this important, and why now? You have no doubt, and I'm sure many of you have seen the WHO report that was released earlier this year that says 800 women continue to die every day due to preventable causes related to pregnancy and childbirth. A woman in sub-Saharan Africa today has a 1 in 40 risk of dying in childbirth in her lifetime. This should make us enraged. This should make us uncomfortable. Just yesterday, I got a note of somebody who was calling a GoFundMe to get an ultrasound scan in my native country of Zimbabwe. And she is 9 months pregnant. She's got a breech presentation, and she is trying to raise $453. She is at a risk of dying if many of the things that she listed on her GoFundMe are not met. They are looking for oxytocin. They are looking for many things, including just cotton wool, for her to be able to have a cesarean section. Now, these figures are saying 1 in 40. That is nearly 5 times greater than what we are seeing in South Asia, and 100 times greater than in Europe and in North America. Ladies and gentlemen, these numbers may obscure economic realities that we see in countries which actually unravel many health and economic disparities. We are also seeing geographic disparities within a country, and of course, this figure obscures that. The particular impact that is felt by people in fragile and crisis settings is not necessarily felt if we just talk about a number. We know that fragility in many instances has become the new normal, where many of these women are dying, with 1 in 4 people in the world living in fragile settings. Most of them, they are women and children. We are talking these days, and as we exited the Women's Month last month, the gender disparities in health service deliveries could not be clearer when you look at these statistics. Most pregnancy-related deaths, they are preventable. And we know that having the ability to decide when to have children is a critical maternal health intervention alongside antenatal care. This is what FP 2030 stands for. Looking forward to a world where women everywhere can decide if and when they want to have children. We also know that gender norms around fertility, household decision-making, family size, these significantly influence postpartum family planning uptake. And finally, most importantly, the services must be there. We need to make sure that services that women seek, services that women need, are there at the point of delivery. Every woman should live within 5 kilometers of centers where she can seek care for pregnancy and family planning. I know the world is ramping up to ensure that there are more green spaces than ever. Could we even start by ensuring that women do have a center where they can seek pregnancy-related care and family planning services within their vicinity and within their reach? But we also know what works, ladies and gentlemen, and many of you have done research. You have actually done programming globally. You know that training and equipping midwives and health officers to deliver family planning counseling as part of antenatal care does improve family planning uptake, as does engaging men as partners. Some of our partners who we work with, including international ICM, including FICO, they are working tirelessly across the globe to ensure that services are delivered by well-equipped midwives and by well-equipped obstetricians across the globe. We really applaud your effort in doing this. Involving partners in maternal health and family planning care has been shown to improve maternal health outcomes and family planning uptake, which is why we need to endeavor to do more around including men as partners. Ladies and gentlemen and colleagues, in the face of what we know and we've observed over the years in terms of constrained health budgets, we see the real value of leveraging our investments in family planning, maternal and newborn health, and primary health care. Silos are very expensive, but if we can put our resources together, we can achieve so much more. Now, since 2015, as FP 2030, we've been collaborating with global, regional, and local partners, some of whom are represented today. This includes the Partnership for Maternal, Neonatal, and Child Health, the Align MNH, and other global, regional, and national partners. First, I want to thank you for all your efforts in collaborating and in operationalization of our partnerships, including some of the normative agencies like UNFPA and WHO. This has helped us to build a strong network of support, especially for postpartum family planning. Now, there are many examples of where this is working. We can see how Rwanda's own investment in postpartum family planning has paid off as well in better maternal health outcomes and family planning uptake. There are many other exemplars. I have mentioned before, Zimbabwe is another exemplar of how they've managed to integrate family planning to maternal and child health, even though more needs to be done in these countries. The evidence is there that when we are able to leverage investments, when we are able to integrate services, we do get stronger results. And this is why we believe as FP 2030 that we are stronger together. Now is the time, ladies and gentlemen, and we are at the midway point of sustainable development goals. This keeps me awake at night. And if we are to reduce maternal mortality ratio to less than 70 deaths per 100,000 births, to ensure universal access to reproductive health care, and to end preventable newborn and child deaths by 2030, we have a long way to go. You and I need to work together. We need to plow in. We need to dig deeper to make sure that we do accelerate progress. We do work together, and when we work together, we become stronger together. But there is a cost if we do not. There is a cost in terms of missed opportunities. There is a cost in some of the women who may not access the much needed postpartum family planning or even the prevention of unintended pregnancies. We are looking forward to engaging with you all at a series of global meetings that we are planning as FP 2030 this year, and some where we are partnering with many, beginning with the International Maternal and Newborn Health Conference that is hosted by Align MNH in Cape Town, and I do look forward to seeing many of you there. We are so glad Anita Gibson was able to join us to share why this moment is so crucial. We will share best practices in family planning, maternal and newborn health, integration, and we will be intentional to look for opportunities that scale up proven programs. Ladies and gentlemen, I think it is important for us to learn. And as FP 2030, and hopefully as this whole community, we will also learn from Suzanne how Rwanda dug in and invested in this proven healthcare intervention and seen great results, as I alluded earlier. FP 2030 is North Central and West Africa Hub Youth Advisor Margaret Bolaji will remind us as she talks about her own lived experience as a young mother and also as a program officer who is focusing on youth for FP 2030. She will remind us that social and gender norms have a particular impact on young people. As FP 2030, this is an area that we are intentionally focusing on around how do we ensure that the right method mix and products do reach adolescents and young people. And let us not forget that we need the support of the donor community to help drive integration. Thank you, Mina, and all our speakers for joining us today. The preeminent, if you recall, the Egyptian obstetrician and gynecologist who was a former president of FIGO, Dr. Mahmoud Fatala, once said, "Women are not dying because of diseases we cannot treat. They are dying because societies have yet to make the decision that their lives are worth saving." The woman I spoke about earlier today, who actually did a GoFundMe because she is pregnant, her name is Betha. I am Betha. Many who are in this call today do represent Betha. Do you believe truly that Betha's life is worth saving? We believe that women's lives at FP 2030 are worth saving. We know what interventions work. Let us work together to accelerate progress to improve family planning and maternal and newborn health care. I believe that we can do more and we are stronger together as a community. Let this be a movement, ladies and gentlemen, colleagues and friends. Let it not just be a moment. Let it not just be a webinar. Let us all make that intentional statement in our hearts that says, this movement starts with me. I want to be part of it. I want to break silos. I do not want to be part of an intervention that misses opportunities. Ladies and gentlemen, we are stronger together. I would like to take this opportunity to thank all of you for attending this webinar, to thank all of you for putting it in your hearts to be intentional and believe that Betha's life is worth saving. There are millions of Bethas today, and there are many more who, if we are not intentional, we will not reach that 70 mark that we are aiming for SDGs. I would like to now introduce Monica Kerrigan, who is our managing director for our hub in North America and Europe, and she is going to be moderating our panel next. Over to you, Monica. Thank you.
Thank you, Dr. Samu, for your bold, brave, and pioneering leadership. As we invite our panelists to turn on your videos, we also want to acknowledge and recognize the webinar participants today for your contributions every day that you are making to be change makers, transforming our world and saving lives. No woman should die giving birth, and we applaud your steadfast commitments to these incredible efforts. So our first panelist today is Anita Gibson, Align MNH Secretariat, and we welcome you, Anita. It's so great to see you today. We're excited about the work that you are doing at Align MNH. And as Samu mentioned, we're committed to collective action to reduce maternal and newborn deaths. So we're going to kick off with two questions. The first question, Anita, is can you share the vision, objectives, and guiding principles of Align MNH? Over to you, Anita.
Yeah, no, thanks, Monica. And sincere thanks to the organizers, Dr. Samu and the team, for the opportunity to share the work of Align MNH with all of you today. I'm really excited to be here. I think maybe the way to think about Align MNH, simply put, I'll just start out by saying Align MNH is a knowledge sharing and convening platform. And we were established in response to the recognition, as Dr. Samu mentioned, the time is really growing short to reach the SDG era targets, particularly for maternal and newborn health and prevention of stillbirths. Those are kind of the areas that are very important to Align MNH. And, we recognize that urgent action is needed now to accelerate progress if we want to meet those collective goals in 2030. And so I should mention, as just background, Align MNH is guided by an international steering committee of thought leaders, the majority of whom are living and working in countries with the highest burden of maternal mortality and morbidity. And so when you think about what we're all about, one of the things that Align MNH did when we got started is we wanted to understand like what our overall objectives and focus should be. And we wanted to understand how, as a knowledge sharing and convening platform, we could really contribute to accelerating progress. You know, we definitely didn't want to duplicate efforts. There are other players in this space. So we did some formative work where we consulted with hundreds of stakeholders, actually, which really, the results of which informed our focus. And I think it's helpful to think of Align MNH with three major aims, if you will. So the first is really to nurture meaningful collaboration and build a common agenda. And we're extremely excited. You know, Dr. Samu talked about partnerships. We are really working very closely with the Ending Preventable Maternal Mortality and Every Newborn Action Plan partnerships and initiatives, ENAP and EPMM, for those of you that might be familiar. And you might know that these groups have come together to develop joint coverage targets, milestones. They're developing related frameworks to really kind of bring the thinking together around maternal and newborn health. And as they build a common agenda, Align MNH is very well positioned as this knowledge convening sharing platform to kind of support and amplify these efforts. So these partnerships are very important in terms of nurturing this collaboration and building a common agenda with these partners. We also see our second kind of aim, if you will, to really streamline and accelerate knowledge sharing. You know, I know many of you are interested in hearing about the conference, and I think we're going to talk about that in a moment. But please know that our platform, in addition to the conference series, includes a knowledge sharing hub. Check out alignmnh.org if you haven't already. And since we got going in earnest during the pandemic, you know, we actually kind of held a couple of virtual conferences and convenings over the past couple of years. So we're looking for opportunities and moments to bring the community together in different ways. We also recognize there's a lot of information out there, but we need to really kind of pull it together in ways that are understandable and really kind of help spark discussion and reflection. The third kind of main aim for us is to really address knowledge gaps and highlight not only what works, but how. How does it work? And we've got a really keen interest in implementation science in particular, and are really committed to ensuring that country perspectives and priorities inform our work. You know, as we promote discussion of evidence and learning, research is extremely important to us, but we also want to focus on really practical solutions that address realities on the ground. So this notion of kind of what works on the ground is very important to us. So I might just leave it there, Monica. There's a lot more I could say, but I know you've got other questions coming.
Thanks so much, Anita. And by the way, I have used your website a great deal and really love, you know, and I hope everybody would pop onto it, because it really is about collective action, urgent action that together we can make a difference. So I know many people are very interested in hearing more about the International Maternal Newborn Health Conference that will take place in Cape Town, May 8th through the 11th. And Anita, I know you and your team and the Gates Foundation and USAID, everybody's working night and day to make this happen, along with the 30 country delegates. So we'd love to hear more about the conference and how this fits into a broader discussion taking place in the maternal and newborn health communities. Thanks.
Yeah, absolutely. So first, I should say, I loved some of the comments that Dr. Samu made in the introduction, because she talked about this notion of a movement. And so I just really want to amplify and support that, because while I should say, I mean, Cape Town is such an important opportunity and a moment. It is part of a larger ongoing movement, if you will. And even thinking about the planning for the event, it involved so many hundreds of partners coming together to prioritize and plan as part of this broader movement. I think a lot of the conversations about what should be featured, what should be prioritized, really reflect the conversations as part of this broader movement. So there's a lot I can say about the conference, but to boil it down, I should mention for this particular audience, because many of you in the family planning community, I so appreciate that you've been coming together in multiple ways over the years, including the International Conference on Family Planning, for example. I think ICFP perhaps has taken place maybe 6 or so times over the last 12, 13 years. I wanted everyone to recognize that the MNH community last met in 2015 in Mexico City. Yes, it was 2015. It's been 8 years since the community has come together. So the International Maternal Newborn Health Conference, or IMNHC, represents the first time the community is coming together in about 8 years. So as you can imagine, there's a lot of catching up to do. But what I'm happy to report is that also IMNHC represents the launch of a series of conferences to take place every couple of years through the SDGs. So this presents a regular opportunity to bring the community together. I think the other thing that I've noticed from the family planning community is so impressive that the family planning community understands the importance of data. And so we've kind of taken a cue from some of these other communities. And the first day of the conference is going to include the launch of the first ever joint progress report from both EPMM and EMAP. And this is extremely important because it's really going to lay the groundwork to review data as a community, discuss progress. And because we'll be meeting every couple of years, it'll lend itself to serving as a bit of an accountability mechanism for future convenings. Where are we? What did we commit to? Where did we say we were going to be? So that kind of data piece is really important to us. And of the approximately 1,800 delegates who will join us in person in Cape Town, Monica mentioned country delegations. We're really excited to welcome. In the end, we're actually welcoming 28 official country delegations to the event. And I should mention that, I don't know if everyone knows, but countries actually had to submit expressions of interest to join as official country delegations. So they actually had to submit an application that outlined kind of what they thought some of their challenges were, their drivers of progress, what they sought to learn during the event, and what they felt they could contribute. You know, we really wanted country delegations that were willing to come, roll up their sleeves, really engage in the conversation, and really contribute kind of their learning and kind of ask lots of questions. So we have this kind of country delegation piece, in addition to perhaps what some of you, and maybe some of you will be presenting in part of the discussion and sessions. We do have a number of kind of scientific concurrent thematic sessions kind of going on in the program. So in brief, the conference represents a few of these very important elements coming together, kind of a review of data as a community, kind of the sharing of evidence and learning through abstract-driven tracks, thematic sessions, technical marketplace, and so forth. But then we also have some dedicated time for those country delegations to reflect on what they've learned and what this means for kind of the work in their countries and their existing plans. So we felt it was important for the conference to really capitalize on the opportunity to bring these different pieces together. So maybe that's a very broad overview. There's so much more I can say, but I really look forward. Please, I encourage questions. I'm happy to share more information if folks are interested in different aspects of what we're planning.
Thank you, Anita. And I'll ask people to, put those questions in the chat as we move along. But again, it's great to have you here. Now we're going to shift to our second panelist based in Kigali. And a key guiding principle of FP 2030 is our focus on country leadership and commitments. And we want to welcome Suzanne Mukakabanda, a family planning quality of care specialist from IntraHealth International in Rwanda. And FP 2030 applauds the government of Rwanda's commitment to scaling up high impact practices. So welcome, Suzanne. And we're very interested, Suzanne, if you could share with us how the government of Rwanda approached scale up of postpartum family planning using a systems approach. Many of us see Rwanda as an exemplar in so many areas. So thank you so much for Suzanne.
Yeah, thank you, Monica. Thank you for giving us this opportunity to share how Rwanda have been integrating or scaling up immediate family planning in the postpartum period. Of course, the scaling up of PPFP was not done in one day. It was a journey. Since 2010, we pilot PPFP in 3 health centers and 1 hospital, especially this was a PPID. And then after 2012, the expansion was done in around 4 district hospitals and 8 health centers. And this was up to 2014, and this was followed by a regional meeting in Zimbabwe and for 11 African countries to see what happened with this piloting phase, and then after WHO reviewed the medical eligibility criteria to integrate some family planning method which can be offered in immediate postpartum. Of course, Rwanda was following all steps, and of course, Rwanda has updated the guideline, the tools to align with this medical eligibility criteria tool, and PPFP was scaled up in the whole country up to now. Of course, multiple partners come in to support the government of Rwanda to scale up this postpartum family planning, especially in immediate postpartum period, because from 6 weeks, we have been doing family planning. We focused on immediate postpartum family planning. Of course, this was done systematically. As I said, it was not done in 1 day. And the first things was to do a situation analysis from this experience of piloting and to analyze and generate recommendation to design how the scaling up phase 1 will be done. Of course, additional to the analysis of the experience, management team for scaling up immediate PPFP was set and put in place, and many consultation was done with key stakeholders and the scaling up management team. After that, we scale up in phase 1. This was a period of learning what is working, what is not working, what can we adapt according to our situation. We designed the rolling out design, and at this period under MCSP, MCSP has assisted the Ministry of Health to roll out in 4 districts with all health centers and the hospitals in those districts. Of course, the management team was following. The management team here is the family planning technical working group, who is looking for all intervention done in the country with, of course, other partners, including ESID, ENFPA, and others. And of course, we set up a monitoring dashboard for this monitoring, and we learn from this phase 1 to roll out. After this phase 1, the Ministry of Health organized a workshop to finalize our plan, to put in place a plan, including, of course, the cost and the other things, and to see what happened in the monitoring on our dashboard, where we were monitoring what is happening at a daily basis. Of course, we reviewed the results of this scaling up, and we, of course, we make some correction because we are still learning. And after that, the rollout of PPFP was done in the whole country, and up to now, we continue to implement PPFP. For now, all our hospitals, all our health centers, even in our health post, even at the community level, each one is implementing a piece of immediate family planning, of immediate family planning in the postpartum period. Of course, we continue to review our data. We continue to share our data at a quarterly basis with the managers of health facilities, but also in this management committee composed by the FP Technical Working Group members. We continue to look on PPFP data to look where it is going where it is not going well, what is happening. So briefly, this is what we have been doing systematically, but of course with many action. Perhaps I do not have time to go in detail for all those actions, but this is how Rwanda have been doing systematically up to now. And now the PPFP is playing a big role in advancing our family planning program and our maternal and child health program.
Suzanne, thank you so much. And many of us see Rwanda as an exemplar and have visited your country. And I just want to, again, reinforce what you said about the use of data. And Anita brought that up also. You know, data is so important to be able to improve our quality, to improve access and coverage. And I think there's so much we can learn from Rwanda. So Suzanne, let us come back to you if we have time, because I think many people are going to have some questions for you later in our program. Our third speaker is Margaret Balaji. And Margaret is FP 2030's Adolescent and Youth Reproductive Health Specialist. And we're so excited to have you back, Margaret, at FP 2030, playing a leadership role on adolescent and young people. As you know, pregnancy and childbirth is one of the leading causes of death for adolescents and young people in sub-Saharan Africa. And if we're going to talk about reducing maternal and newborn mortality, we better be talking about young people, right? And so one of the questions that we have for you, Margaret, is in meeting with pregnant and postpartum young mothers in Nigeria and other countries that you have visited, what are the challenges that young people are facing during this critical period? And how do you think partners and stakeholders, many of who are on the line, and by the way, we have almost 200 people from around the world listening and learning with us, what do you think they can do to take collective action to support FP-MNH integration, especially for youth? Thank you.
Thank you so much, Monica, and I hope you can hear me. And thank you. It's really great to be back to FP 2030. And again, just to reiterate, like Dr. Samu mentioned, central to our vision and goal is the fundamental right for all individuals. Particularly, I know we usually say including young people, but this is me saying particularly young people and in all their diversities, because this is also very important. I'm going to have to talk about how one size doesn't fit all, but then that they have this fundamental right to decide freely and for themselves whether, when, and how many children they want to have, to lead a healthy life and participate as equal partners or equals in the society and its development. And for me, just recently joining FP 2030, like you mentioned, and where I lead an inclusive, responsive, as well as sustainable partnership with youth, and of course, civil society partners in the North and West, Northwest and Central Africa. In my position, I am happy that I am building on the success of FP 2020, and this also includes the strong use of data and high impact practices in-country adolescent and youth commitment. So we can see obviously that countries are beginning to, more than ever before, make commitments that actually influence and also affects adolescent and youth. We also see that through the rapid response mechanism, a lot of youth-led organizations were funded in the past, and also having young people as part of meetings with country officials. But of course, we need to take that even to another level. I mean, that's why we're talking about partnership, not just participation. And it's also important to see how we're supporting youth-led organizations to make effective and actionable commitment. But of course, building on this groundwork for me is how to see how best we can strengthen the capacity of young people in this hub, but also sharing possibilities and opportunities, whether funding or access to different kinds of support and resources in order to help them make commitments and be able to support young people access to family planning. And interestingly, even as I just switch from talking about my role, is that we're also setting up the Adolescent and Youth Center of Excellence, which will really position FP 2030 adolescent and youth work to be a thought leader in the space. And I welcome you all to join us in this journey. We will be reaching out to a very big on partnership, like you already know. And you know, this session, this webinar, it's very important to me. It's dear to me, both personally first and then professionally. And the reason I am saying this is counting back to when I had my first baby in 20, now a boy, a big boy, in 2019. And it was just a few months into the whole issue around the pandemic, and I needed to access family planning. You know, while working with young people, I know how terrible, how very hard, how vulnerable, especially marginalized adolescents and youth can have access to. And I felt mine was just going to be walk into the facility, just put a call through, or just have access to this very life-saving commodities, like we all agreed and we all know. But I had to go through a lot of hurdles, no thanks to the pandemic. But beyond that is the fact that even at this age and time, and this is me living in a city, the center of a capital of Nigeria, and I still get to being asked questions around my age. People are concerned about, providers are concerned about parity, providers are concerned about a whole lot. And you could obviously see providers' bias even in me accessing family planning services. And just having to go through that and not even having access to the wide range of contraceptive, and then you're not getting balanced counseling, or you're just stuck with one method, most likely condom, just because someone feels that you're young, and it's okay to just go with that, even when you have a choice of the long term, because you definitely want to space your child and what have you. And just going back to that experience, it really saddens my heart that while from data we could see some improvement, and just to say thank you to the global community, to the national community, to the local efforts of partners and everyone, making sure that we're reducing the adolescent birth rate, but there's still so much that needs to be done. According to the UNFPA report, we see that Nigeria is among the countries with the highest risk of repeat childbearing in adolescents. That is the chance of having another child within 2 years. We know that this kind of repeat or rapid repeat births are associated with severe health risks, both to the mother as well as the infant. Again, this is not just peculiar to Nigeria. In countries like the Central African Republic, Chad, Guinea, they are also among countries with the highest level of births to very young mothers. All of this really underscore the reason and the importance of ensuring that in all that we do, even while integrating, even while speaking about family planning to family planning in maternal and child health, we have to definitely be sure that we have young people driving this change that we want to see. Two major barriers that I've had from young mothers like myself, when we go to hospital, when I speak with them, when I also communicate and we have conversation, there are several, but bias and policy. With bias, we see a lot of family providers bias. And in some cases, you would even for some providers, it might not even be a personal bias, but they are often operating in a fragmented system and supply chain, which is meant only to address specific need of this patient, of this adolescent. So adolescents are coming in with mental health issues. They also want family planning and several other services, but then the system is fragmented and it makes it quite difficult to access services. We also know that young parents are sometimes overlooked by family planning programs and even maternal and newborn health program. And they're sometimes termed as being too young, or they're too, why should you be accessing family planning, contraceptive at this age? And or in some cases, when we talk about stock out, then, oh, maybe the older ones need it better than the younger ones. And a whole lot of roadblocks that young people continue to face with when it comes to accessing family planning services and in general, maternal and child health services. But also talking about the restrictive policies. In some cases, we've often said, yes, we have good policies, they just need to be implemented. Very correct, but we also need to dig deep into those policies. Some of those policies are quite ambiguous, and then it leaves it at the discretion of the providers. It leaves it at the discretion of anyone who chooses to. But we have to continue to see, how do we ensure that issue around parental consent, issue around age, access to family planning, and also ensuring that the services are integrated, it's well taken care of. Those are key things that we need to look out for. And I think for me, it's just important to know that while there have been overall progress, and we have to say countries, communities, and families are still being left behind. So this is us acknowledging it, and we have to do something about it. We need to remember that one size doesn't fit all. And that's why I had to constantly keep reminding ourselves that young people are not homogeneous. Adolescents and youth are not homogeneous group of people. And it's also important that we're asking the right questions, the tough questions. Who is left behind? Why are they left behind? What can be done to address the situation? But the what and the why and the how must not just come from them. It must be led by these young people themselves. It must be evaluated by young people. Only then can we then build a very strong and synergy between family planning and maternal and newborn health. And I would just take a stop at this point. You might have other questions, but just to really say that this is a generation where we have young people in their reproductive age like never before. And if we seriously mean business, then we will really be talking about the over 1.8 billion young people who are still struggling, most of them in sub-Saharan Africa, to have access to reproductive health information and services, which we know ultimately help them to decide and live their healthy life and fulfill their maximum potentials. Thank you.
Thank you so much, Margaret. And already, I think everyone around the world can feel your passion, your inspiration, but your push to have young people drive that change, and for us all to be curious and asking those tough questions. Who's being left behind, and how do we ensure that young people are a big part of our solution moving forward? So thank you so much for being here, and I hope people will put their questions in the chat for Margaret also. Our last panelist I want to introduce is Dr. Meena Gandhi, Senior Health Advisor for FCDO, and welcome from Nairobi, Meena. We're so happy to have you here. And first of all, we want to thank the government of the UK for their commitment to ending preventable deaths, and offer a special thanks to Minister Andrew Mitchell for his strong leadership and support, first of all, kicking off FP 2020, and also scaling up life-saving solutions. So thank you again. Meena, we'd love to hear from you today more about FCDO's 3 key messages on equity, quality, and integration to energize the global fight against maternal and newborn deaths. Can you tell us more, please?
Yep, sure. And thanks everyone for inviting me to this. Maybe I can backtrack a bit about the Ending Preventable Deaths work. So in late 2021, we launched an approach paper on ending the preventable deaths of mothers, babies, and children, and a campaign with it. And Minister Mitchell is actually the champion of this, what we call EPD approach. And we launched it, because we knew the need was still there. And we actually launched it during the pandemic, despite a lot of health turmoil going on. And we did that deliberately because despite all the uncertainties, we felt there's a need to put a stake in the ground for essential maternal newborn health services and health systems, actually, because we see the two as very, very linked. So that's what we did. We're using an approach that is broad. It is deliberately broad because we really feel that now, if we want to tackle this, it has to take a broad approach. And we almost have no choice but to look at the wider causes around ending preventable deaths. And although it will involve some new programming, probably, largely it's about doing what we already do, but doing it in a much more joined up, efficient, collaborative way. So there's basically 4 pillars of action, and there's the 3 messages that you have mentioned, Monica. The 4 pillars, just to go over very quickly. The first one is about strong health systems. The second one is about human rights, gender and equity, and that includes SRHR. The third one is around healthier lives and environments. So that includes WASH, it includes climate, air pollution, it includes nutrition. And the final one is around research, tech, and innovation. So those are the 4 sort of pillars. And then we have 3 overarching messages, I would say, that sort of run across everything. And those are the 3 that you talked about, Monica. Equity, quality, and integration. So I will talk more about integration, but just to talk about the first 2 quickly. Equity, I mean, Margaret just described it really eloquently. The deaths are now happening in the youngest, the poorest, those in crisis settings. We know that the data has showed that, and unless we in our programs, make sure that that's included, then we're not gonna solve this problem. And equity, I have to say, is an issue not just for low-income countries; it's an issue in all countries, including some very high-income countries. The second one is around quality. We know that almost equal numbers of deaths are occurring because of poor quality as poor access. And also we know that disrespect and abuse is still a massive issue in maternity care settings. So that's another thing that we're hoping to make sure quality is integrated within our programs from the beginning. And then the final one is integration, and I know that's the one that this whole webinar is about. So maybe I can talk about that. Now we're looking at integration broader, to be honest, than just FP and maternal newborn health. We're looking at it as a way of approaching our work. It's a way of linking up the different streams of things that we support. So, for example, it's about not trying to fund just one piece of the health system, supporting just one disease, but looking at how we can broaden that support to support the broad health system. And if we can't do that ourselves, how to link up with others and make sure that we're not doing things that are impractical and unhelpful, really, for countries. That's one aspect of integration. Another aspect is around the social determinants of health. So water, nutrition. It's really about trying to own those things and understand that deaths are happening because there's no, say, WASH in health facilities. And that is not just a water issue, it's a health issue, and it's a health sector issue, and the health sector has to own some of these things. So that's a second aspect to the integration. And the third, I would say, is coordination and alignment. If we can really try and improve the way we work to support government and government priorities with others, but also within ourselves. If we're supporting the global health initiatives, we have central programs, regional programs, country programs. The third aspect of integration is really how to get those working for these common outcomes. So I'll stop there on the 3 messages.
Thank you so much, Mina. And you've just reminded us that 45, I think it's 45% of all maternal deaths are happening in fragile and humanitarian countries, and 60% of newborn deaths. So a really important reminder that none of us can do this together, that the partnership is so important. And we'd be excited to learn more about the UK's Ending Preventable Deaths campaigns focused in your 11 flagship countries. Could you share a little bit more about that approach?
Yeah, so we have focused on 11 countries in Africa and Asia. Low income, low middle income countries, chosen based on need partly, but also where we have worked for a long time, where we feel there is there's something that the UK anyway can build on. We are looking. I mean, our countries are decentralized, so we don't tell the country posts how to program, but we imagine that they will have some programs covering some of the pillars of EPD, maybe not all of the pillars, and they will, and that's up to them entirely. But the EPD is a framing for how they work. But we're also looking in those countries beyond programs. So what are the policy bottlenecks? What are the things that government really wants to push that we could help with? And that's using we have a large advisory network, we have a large policy advisory network, we have a diplomatic network that's huge, and we have Minister Mitchell. So how can we really try and support these policy changes that would be game changers for this? So that's another aspect of the work that we're doing. We will then be linking up our technical support, technical assistance support with those countries. So in March, we launched a new EPD support program that will provide long and short-term technical assistance to the 11 flagship countries, and there'll hopefully be more of that coming. And then along the way, we'll keep monitoring what we're doing, both quantitatively and qualitatively. You know, what are the policy areas that have managed to move, and that sort of thing. So that's the general approach.
Thanks so much, Mina. Really appreciate that. And again, if people have questions, we'll be answering those questions in emails in our newsletter. But keep posting those questions, please. Now it's time for all of you to get an opportunity to share your insights too, and we'd love to hear from you. So we'd appreciate if you'd share your best practices on integration and scaling up evidence-based and high-impact practices in the chat. And feel free to share links to resources that you found helpful, and we'll include them in our newsletters. We also have time for 1 or 2 participants to quickly share examples of what your countries have accomplished in terms of family planning and M&H. So if you wanted to raise your hand, please let us know in the chat box. Yassine Bai will be looking for those people who might want to say a few words. So let's see if there's anyone out there. And we also have some really great questions for our panelists too. So we could, but let's first see who's out there. Over to you, Yassine.
Thank you, Monica. I think we had a question in the chat, a good question on family planning financing commitments from John Kutna. John, we will allow you to speak if you would like to ask your question live.
John, would you like to ask your question? Or Yassine, would you just like to read it, please?
Sure, I could read it. So I think this question is directed for Suzanne, thanking her for the good work in Rwanda and mentioning the biggest challenges facing in Africa is on financing, especially for family planning commodities. So could you please share some experiences in getting governments to commit to financing for family planning? Over to you, Suzanne.
Thank you. Can you please repeat the question?
Yes, the question is around how do you encourage governments to make financing commitments for family planning?
Yeah. Thank you so much for the financing of family planning, globally, or intervention in the even commodities. In Rwanda, first of all, we do a quantification exercise for commodities led by the government of Rwanda. We plan for around 4 to 5 years to know which commodity will be used. And as I say a few minutes ago, all those are coordinated by the Family Planning Technical Working Group. And after this quantification and the budgeting of what will be needed in family planning, this is discussed in the high level institution of the Ministry of Health and the government of Rwanda. And we know what are our needs, and of course, partners are intervening in financing family planning, but also the government is financing a big part of our family planning program, starting from the commodities, staff, materials, or those things. Yeah, so all needs in terms of budget are controlled by the government of Rwanda. They know who will finance this and what is the gap. And if it is, if we need an advocacy or a social mobilization, it's the government who is doing that. Yeah.
Thank you. Thank you so much, Suzanne, for just reminding of the political will and tremendous commitment of the government of Rwanda. We appreciate that. Given timing, right now, we just want to really thank our panelists, and a huge applause. It was great. Thank you for sharing your time, your experiences, and your insights. Right now, we're going to move over, and I'd like to invite Helga Fogstad, Executive Director of PMNCH, to turn on her video and join us. This is truly a powerful movement for change, and I tell you, Helga is a change maker. So Helga, thank you for joining us, and just going to wait until I see Helga come on. Thank you, Helga. It's great to have you here. Helga, you're our rallying cry. You've been with us a long time in so many different roles, and we appreciate your tremendous support, and now at PMNCH. And we really love to hear from you about what recommendations and key actions do you propose for the FP-MNH community that each one of us, can take forward to strengthen health systems and advance integration to save lives. Over to you, Helga.
Thank you so much. Thank you for having me. I think what we've heard today is really a rallying cry, and the smartness of integrating services and not making them silo, because it'll just cost less in integrating them and providing them and making them more client focused and people focused. So I think that that's really important. The other is, it's not only integrating services, but it's also looking at integrating policies and support mechanisms and strengthening the system in order to be able to then actually provide better enabling environment, if you will. The other is, it's a cross-sectoral, so it needs to be really understood by other sectors and not only the health, in how to integrate systems so that they actually can do more together than alone. Another thing is, and this was something that Mina mentioned, integration of funding streams. Let's be smart in understanding how to integrating these funding streams and really getting more for current resources. The other thing that I think is really important and was mentioned by several is young people. Young people should be the focus and inclusive in family planning programs and their perspective, and also how to integrate their needs into this. And then lastly, I would really like to say that without data, this is not going to be possible to understand where and what is needed and who needs it in some way. So that data gives us the power of knowledge, of really understanding where, what, and how to really use our resources. Lastly, I think it's an intersectoral, but it's also a multi-stakeholder. So I think all different groups in society have an important role Young people have a role. I think decision makers in the community, faith-based organizations. I do think that parliamentarians have a role, and NGO policy makers, and also the donor community. So all of these, I think, are also in a way important in the equation for integration and inclusive services. So that, I think, is really important. And I think it's really been highlighted by several of the panelists. So those are my somewhat key messages, Margaret.
Thank you so much, Helga, and thank you for your steadfast leadership in this area. You know, we are truly stronger together, and no country is alone in its challenges. And I think, as Dr. Samu said right from the beginning, you know, this is a movement, not a moment. So I look forward to working with all of you, and FP 2030 looks forward to working with all of you in partnership and in allyship to really come together to save women and newborn lives. So. Thank you all today for the great work, and yeah, we can't wait to catch up with you next time. Have a great day.
Thank you, Margaret. Thank you all.
Thank you all.
Thanks.
Bye-bye.